Generally speaking, people who have boatloads of money are choosing Medicare supplements, while those who are living off of Social Security are leaning towards Medicare Advantage. But if you're someone that's in the middle, it can be extremely difficult to decide which plan will give you the better value for your money. Here's the thing, one of these plans is going to save you a lot more money in the long run, and it might not be the one that you're expecting. That's why in this video, I am going to compare the real costs of these two plans side by side. All right, let's start with the cost for these two plans, which is what we call in the insurance world premiums. What are the premiums for these different plan types? We're going to start with the monthly cost for the Medicare Part B premium, because no matter what you do, you're going to have to pay your Medicare Part B premium. So regardless of which plan you choose, for most people, that is going to be $185 a month. Now, you have to pay that regardless of which plan type that you choose, because it's like your ticket to the game. If you haven't paid your $185, you're not going to get a plan for a Medicare supplement or a Plan B. Now, that means that your Medicare Part B premium is going to be $2,220 a year for most people, regardless of whether you have another plan or not. Now, with the Plan G, that premium will vary based on the area that you live in. In some areas, it's very expensive. For example, in New York State, they have more expensive premiums than they have in California or in Texas. But on the average, in most states, discounting New York, the plan premium for a Medicare supplement for someone who's turning 65 is on average $150 per month. Now, that is the Medicare supplement premium, but the Medicare Advantage plans, in most places, you can get a Medicare Advantage plan for a $0 a month premium. That's what you're looking at for Medicare supplement versus Medicare Advantage in most states. Okay, so if we add these up, pretty simple here. We have $335 a month on the Medicare supplement side and $185 a month on this example Medicare Advantage side. So if we're just looking at the monthly cost, we have a very clear winner, which is the Medicare Advantage plan. If you have a zero premium Medicare Advantage plan, then you're only paying $185 a month to have your plan. If you have a Medicare Supplement Plan G in one of the average areas, not the expensive areas, then you're paying $335 a month to have your Medicare Supplement Plan G. So looking at the monthly cost, clear winner, Medicare Advantage, right? So the next question is, what does it cost to use the plan? Because if we know that a Medicare Advantage plan is cheaper on the monthly side, how much does it cost if we need to go to the doctor? So let's go to the next slide here and let's talk about costs of using the plan. Some people think that because Medicare Advantage is much cheaper up front, it must be way more expensive when it actually comes time to use it and go to the hospitals. Well, that's not always the case, and here's why. It depends on the type of treatment that you receive. If you're receiving no treatment versus a light or moderate amount of treatments, or if you're receiving a lot of treatments, which we're going to call heavy treatments, then there are going to be differences in cost. So say that you're in this no treatment zone. You never actually use your plan, you just have it in case you need it. Then what does it cost in premiums? Well, we put the premium of Part B and your plan together. So for a Medicare supplement, that was $4,020 a year. And for a Medicare Advantage plan, it was just your Part B premium. So that was $2,220 a year. So that's all that you would pay if you never actually go and receive services. So now let's look at the light to moderate treatments. Let's say that you're fairly healthy, you don't have serious health conditions like cancer or any major surgeries, but you do go to the doctor several times during the year for minor treatments. You have your annual checkup, you get your flu shot, and you go to see your doctor for that. You see a dermatologist because there's something on your skin that you need to have checked. Your knee hurts and you go to an orthopedic specialist, you have an x-ray, you maybe have some physical therapy sessions, etc. Maybe you've had some heart concerns. You say, I need to go to a cardiologist and just get an EKG test, and I need a 24-hour monitor or something like that. These are what I'd call minor treatments, and these are things that happen as you're aging. You're going to have these checked out occasionally. So how will each plan compare, and what will it cost you in these typical type scenarios with moderate, light to moderate treatments? Well, with the Medicare Supplement Plan G, it really doesn't matter how many times you go to the doctor. The only out-of-pocket expense that you will have is your $257 Medicare Part B deductible. Now, you could visit your doctor or your specialist 100 times. Your out-of-pocket expense is going to be $257. So that only takes you, because it's only the $257, to $4,277 a year, no matter what. Light, moderate treatments doesn't matter. You're just going to pay your Part B deductible. Now, with a Medicare Advantage plan, every single Medicare Advantage plan is going to have different costs for services. Some will say when you see your primary care doctor, it'll be $0. That's pretty typical, but maybe when you see your specialist, it's going to be $20 to $50. Getting an x-ray might be $80. Physical therapy might be $40 each session. I'm giving you some generalized numbers. None of this is a quote from an insurance company. An EKG test might cost $50. A monitor for 24 hours might be $150. So I just want to stress this. There are no set prices for Medicare Advantage. Every plan has its own price outline, and you really need to know what's available in your area. However, if you just need light to moderate treatments, the cost for that is going to range somewhere, let's say, between maybe $500 to maybe $2,000, depending on what you're doing, in these light to moderate treatments. So that gives you an idea. You know, let's take the kind of the middle ground and say it's $1,000. Well, then your total here is going to be something like $3,220 for your light to moderate treatments. So it depends on the plan. Some of the costs can be variable based on your situation. Okay, but now let's talk about the serious conditions. I'm talking about cancer, heart disease, major surgeries, even things like diabetes or complications with health conditions. How much you will have to spend in this type of a scenario is interesting. It's different. But before I show you the numbers, let me just jump in and say that if you're finding this video empowering to help you make Medicare choices, then please hit the like button so that we know that it's working. Because that's really our mission here at PlanFit, is to give you tools and knowledge so that nobody can trick you into the wrong plan anymore. So hit the like button and don't forget to subscribe, because we're going to teach a lot more about Medicare in the coming weeks. But all right, how much will you spend if you need these heavy treatments? Let's start with the Medicare Supplement Plan G. This will be very simple. Medicare Supplement Plan G, remember, the only thing that you pay is the $257 Part B deductible. This is where the Plan G really shines. The Medigap Plan G, the only out-of-pocket, is still just that $257 Part B deductible. So it doesn't matter how many times you see the doctor, how many times you see the specialist. If you have super expensive treatments, your out-of-pocket cost, without drugs, remember prescription drugs are not included in a supplement plan, and that can be very expensive, by the way. But without prescription drugs, your cost is $257. So again, whether you have light or moderate treatments or more expensive, what we call heavy treatments, you're still going to pay $4,277 as your maximum right there. Now, a lot of YouTubers make it seem like if you get a major illness with the Medicare Advantage plan, you're going to go bankrupt, but that's not actually the case. You see, every Medicare Advantage plan has a maximum out of pocket. We call it a MOOP because we love to make up crazy acronyms. So MOOP, maximum out of pocket. A MOOP says when you hit that level, when you spent that much money, you don't have to spend money anymore. That's your maximum out of pocket, just like you had when you had group coverage or you had an Obamacare plan or something like that. Once you hit your maximum out of pocket, then that's it. Now, depending on where you live in the country, these can be all over the map. We know of some plans that have a low $750 maximum out of pocket, but we know of some plans that have a $9,350 maximum out of pocket, which, by the way, is very rare. But on average, your maximum out of pocket is somewhere between $3,000 to about $5,000. That's what the average maximum out of pocket is. I would say more on the lower end on average, but again, it depends on where you live. So that might seem like a lot at first, but if you look at the Medicare Supplement Plan G, you're going to spend that much money regardless. That's the thing with the Medicare Supplement Plan G. You're going to spend a lot no matter what. With the Medicare Advantage, you might spend a little, or you might spend a lot. It depends on your situation. Now let's talk about how both sides of this, Medicare Supplement and Medicare Advantage plan, have some very serious downsides that can cost you more money than what's listed here. So we're going to talk about the additional Medicare Supplement and Medicare Advantage costs, because too many people get caught up just looking at these numbers right here, just looking at the out-of-pocket cost and the monthly cost. But there are three things that you need to know and consider with both Medicare Supplement plans and Medicare Advantage plans. So let's look at these next. These three things I'm going to call other costs and downsides of Medicare Supplement Plan G and Medicare Advantage plans. Now, the first downside that we're going to talk about on the Medicare Supplement side, number one, there is no drug coverage in this plan. And I say drug coverage, I'm talking about Medicare Part D. With Medicare supplements, there is no drug coverage. That's usually built into your Medicare Advantage plan, but you have to enroll in a standalone prescription drug plan over here. No drug coverage is a big deal. Now, the average standalone prescription drug plan costs $45 a month. And at $45 a month, that means that you're going to be spending $540 a year. So you have an additional $540 a year just to have a prescription drug plan. That doesn't count the cost of actually going to the pharmacy. And oftentimes we see that the prescription drug plans available on Medicare supplements do not often equal the Medicare Advantage counterparts. So unfortunately, you often get better prescription drug coverage over here. So that is downside number one. Okay, downside number two is that this plan covers no dental, vision, or hearing care. So you got, we call it DVH, dental, vision, hearing. There's no dental, vision, hearing care in a Medicare supplement plan. There are some supplement plans that might have a little discount benefit or something like that, but there's no true insurance there. Where with a Medicare Advantage plan, many of them have dental, vision, hearing, etc. So you've got to get additional insurance for this. And to get coverage for all three of those, you're looking somewhere between, let's say, $50, $75 to even $100 a month. So if you have to pay another $100 a month here, that's an additional $1,200 a year in costs just to have coverage for things that Medicare doesn't cover and that your Medicare Advantage plan, if you had that, would cover. If you're 65 years old and you're looking at a plan G and saying, well, it's only $150 a month, then that sounds great, but you need to consider all the other things that you're going to have in that plan or not have in that plan. And that leads me to the third downside and the final one that I'm going to talk about today. And the third downside is that over here, you're going to have rate increases. And a rate increase means that the cost of your plan is going to go up. It's not going to stay fixed. When you're 65 years old and you're paying $150 a month, if that's what you're fortunate to get in your area, you say, this is very affordable. I can afford this Medicare supplement plan long term. It's going to be great. Well, maybe, maybe not. If you're on a fixed income, you can't budget at $150 a month because it's a guarantee that it's going to increase. In most states, it's going to increase once for your age increase. So when you turn 66, rate goes up. But when you turn 70, rate goes up. When you turn 71, 72, 73, each year it goes up. In addition to that, it's going to have increases every year because of the cost of healthcare going up. We call it inflation increase. Now, if you're in a state that doesn't have rate increases for age, like New York, you're still going to have inflation increases. And by the way, you're going to pay very high prices. So rate increases is a major downside of a Medicare supplement plan because we know what the price is today. I can't tell you for sure what the price will be tomorrow. Okay, so that gives you some downsides on Medicare supplement plans. So you would, at this point, you would stop and say, well, Calvin, clearly you're pushing people towards Medicare Advantage. Well, hold on, not so fast. Let's talk about the downsides of Medicare Advantage. And the first one I want to talk about over here on the downsides, number one, is network. You give something up to get something, right? The thing that you're giving up with the Medicare Advantage plan is access to Medicare's broad network. You don't get access to the entire Medicare network. You have to go to the network of doctors and providers that are in the plan that you have joined because the plan is offered from an insurance company. So your insurance company has put together a network of doctors and hospitals and you have to stay within that. This is perhaps the biggest downside of Medicare Advantage. So if you're in an area with a really strong network, then it's going to probably be great for you. We tend to see in rural areas that there aren't as many options and that it can be a real challenge for people who live in rural areas and have a Medicare Advantage plan. Maybe there aren't enough doctors and hospitals available to them. They need to travel and now they're out of network, right? Now, there are different options with Medicare Advantage plans. There are the HMO versus the PPO options and debates. HMO, health maintenance organization, you go to your primary care doctor and you get a referral to see specialists. PPO, you can go to any doctor within the network, and the network may be broader, and you don't have to have referrals, but your costs will probably be higher. So there are networks, and that is certainly one of the most prevalent and most talked about downsides of going with the Medicare Advantage plan. Now, the second downside of the Medicare Advantage plan is plan changes. Your plan, you might start out and say, wow, I love this plan. It's fantastic. I want to keep it forever, but your plan might change on you. Every year, plans can make changes. So you know what you have for this year. It doesn't mean that's what you're going to have for all of the following year, because Medicare Advantage plans can change every year. Now, it's rare that a plan becomes significantly more expensive year over year, but you can't just assume that you're going to sign up for one plan and keep it for your whole life. You have to stay up to date with what's happening with your plan changes, and every year during AEP, you have to look. AEP is annual election period. That's October through December. You need to look and see what changed with your plan and say, do I need to make a change, or should I stay with that plan? Okay, finally, number 3, the third downside, and probably the most talked about here on YouTube, is prior authorizations, or prior auth. Prior authorizations are the most talked about thing around Medicare Advantage, especially right now. We even had a big thing in Congress where they had a hearing and talked about prior authorizations. We've seen, all this discussion with Health and Human Services and with CMS, which is RFK Jr. and Dr. Mehmet Oz, talking about reducing prior authorizations. And YouTubers who sell Medicare Supplement Plan Gs, they just go nuts about prior authorizations. So let's talk about what prior authorizations are and what the downside is. And the downside is this: there is an insurance company that has to authorize certain things before you receive them. They need to authorize certain expensive procedures before the doctor can administer them. And if the doctor proceeds without receiving authorization, then you're responsible for paying the full price, right? That's the big issue with prior authorizations. So we have to look at prior authorizations and understand that with the Medicare Advantage plan, there are certain things in play. Number one, there's an insurance company that is managing costs, and that's why they're able to offer the benefits like dental, vision, hearing, etc., is that they are preventing fraud and they are preventing abuse, right? But sometimes people get caught in the middle and they need something and it doesn't get approved, and it's very, very frustrating. And no one wants to be told no to, and particularly you don't want to be told no to when you know that you actually need it. So clearly prior authorization requests are a very passionate topic. But here's what most people won't tell you and what the numbers say, and that is that less than 0.1% of prior authorizations were wrongly denied. 0.1%. So I'm talking 1 out of 10,000 were wrongly denied. Usually when a prior authorization was denied, it's because of a hiccup. A hiccup meaning that your doctor didn't submit the proper paperwork and didn't justify the need. And once they do that, the prior authorization is approved. But the ones that are usually denied need to be denied, because there are people who run to the hospital every time anything goes wrong, run to the ER because they sneezed, right? So we have to have cost controls. And one of the downsides of original Medicare and why it gets abused so much is that it doesn't have any controls like this. So having said that, Medicare Advantage has prior authorization. Medicare supplements, if Medicare approves it, your insurance company has to approve it. So that can be an upside, I would say, on Medicare Supplement Plan G, and a downside on Medicare Advantage. But again, only 0.1% of prior authorizations are denied. But if you want to learn more about that, then check out this video.